Have you ever gotten a lab report back and just stared at it? All those letters and numbers can feel like you're trying to crack some kind of secret code. But here's the thing. Hidden in that data is a really important story about your health. And today we're going to decode one of its most crucial chapters, your kidney function tests.
You know, that routine blood test you get every year? It holds so many clues about how your body's most important systems are doing. And when we're talking about your kidneys, understanding those clues isn't just interesting, it can be an absolute game changer for your long-term health.
So here's what we're going to cover. First up, we'll get into what your kidneys actually do. They're pretty amazing. Then we'll talk about why testing them is so important. After that, we are going to break down the key tests you'll see on a report. And finally, we'll learn how to make sense of your results.
Okay, let's start at the beginning. What exactly are these master filters, and what are we even looking for with these tests?
I want you to think of your kidneys as the body's ultimate super high-tech purification system. It's incredible, but every single day they filter about 200 quarts of blood. From all that, they pull out about 2 quarts of waste products and extra water. They are just working around the clock to keep your body's chemistry in perfect balance. So, kidney function tests, or KFDs, are basically our way of running a diagnostic on this whole system. It's like a performance review to see if they're still filtering like they should be.
This brings us to a really critical question. Why should we pay such close attention to these tests in particular? What's the big deal?
Well, it's all about catching things early. See, the main goal here is early detection, because kidney disease can be really quiet in its early stages. You might not feel a thing. These tests help us spot trouble long before it becomes a major problem. And for anyone who already has a diagnosis, KFTs are absolutely essential for tracking the disease, seeing how well a treatment is working, and making sure certain medicines aren't causing any harm.
So who needs to be getting these tests? Well, honestly, they're a part of many routine checkups for a reason, but they are especially vital for people with high blood pressure or diabetes, since those are two of the biggest causes of chronic kidney disease. Doctors also use them to keep a close eye on patients who are taking specific drugs that can be a little tough on the kidneys.
And this right here, this shows you exactly what's at stake. The difference between a healthy, happy kidney and one that's injured is pretty stark. The whole point of regular testing is to keep things on the left side of this picture, to stop that damage before it even starts. When it comes to kidneys, early detection is everything.
All right, let's get into the part that can look a little intimidating, the tests themselves. But don't you worry, we're going to break down the big ones into simple, clear terms that actually make sense. First on the list is serum creatinine. So every time you move your muscles, they create a waste product called creatinine. It's totally normal. And it's your kidney's job to filter it out of your blood. So it makes sense, right? If your creatinine level is high, it's a little red flag that the filters might be getting clogged up and aren't working as well as they should be.
Next up is blood urea nitrogen, which you'll almost always see as BUN. When your body breaks down protein from the food you eat, it creates another waste product called urea. And just like with creatinine, high levels can mean there's a kidney issue. But, and this is important, BUN can also go up for other reasons, like if you're dehydrated or on a really high protein diet. That's why doctors always look at it along with the other tests to get the full story.
Now, I want you to pay close attention to this number, greater than 90. If you remember one number from this whole thing, make it this one. This is the goal, the gold standard, for a healthy eGFR, which many consider the single best measure of your kidney function.
So what in the world is eGFR? Well, the E stands for estimated, and unlike the other two, it's not a direct measurement of something in your blood. Instead, it's a smart calculation that uses your creatinine level, your age, and a few other factors. What it gives you is an estimate of how much blood your kidneys are cleaning every single minute. It provides a much clearer picture of your overall kidney function than creatinine alone.
And finally, we have to look at what's coming out in the urine. See, healthy kidney filters are designed to keep important things, like a protein called albumin, in your blood where it belongs. If that protein starts showing up in your urine, it's a sign that the filters have become kind of leaky, which is actually one of the very earliest signs of kidney damage.
So how do we put this all together? We've got all the pieces, so let's look at what these numbers actually mean when you see them on your lab report.
But before we dive into the numbers, let's just hammer this home one more time. Early diagnosis is absolutely 100% key. Understanding your results is what empowers you and your doctor to take action long before any serious damage can happen.
And here it is, your official cheat sheet for making sense of it all. For healthy kidneys, you want to see your creatinine under about 1.2, your BUN under 20, and that all-important eGFR above 90, with basically no albumin in your urine. Now, on the other side, the warning signs start to pop up. An eGFR that drops below 60, for example, is a clear sign of chronic kidney disease. This chart really puts everything we've talked about into one clear, simple picture.
And there you have it. Your kidneys are these silent, incredible workers. They're on the job 24/7 and they almost never complain until a problem is already pretty serious. Understanding your kidney function tests helps you speak the same language as your doctor and really take an active role in your own health. When you think about everything they do for you day in and day out, isn't it worth checking in on them once in a while?